Osteopetrosis and Erlenmeyer Flask Deformity by Gabriela Cueva. Osteopetrosis. It refers to a group of rare heritable disorders of the skeleton characterized by increased bone density on radiograph. The overall incidence of this condition is difficult to estimate, but autosomal recessive osteopetrosis (ARO) has an incidence of 1 in 250,000 births, and autosomal dominant osteopetrosis (ADO) has an incidence of 1 in 20,000 births. This condition varies greatly in their presentation and severity, ranging from neonatal onset with life-threatening complications such as bone marrow failure, classic or malignant ARO, to the incidental finding of osteopetrosis on radiograph. The severe infantile form of osteopetrosis are associated with diminished life expectancy, with more untreated children dying in the first decade as a complication of bone marrow suppression.
Osteopetrosis by Dave Dubell and Caitlin Jacob.
Osteopetrosis, named for the German radiologist Dr. Albers Schoenberg, is defined as a disease of dysfunctional osteoclasts that leads to an increase in overall bone density. This is a picture of Dr. Albers Schoenberg, who discovered the disease in 1904. This disease has 3 different forms which affects its severity. These forms are an autosomal recessive infantile form, an intermediate autosomal recessive form or marble bone disease, and an autosomal dominant adult form. Osteopetrosis has not been found to have a gender predilection, and its incidence and prevalence are not well agreed upon in literature. Some sources say 1 in 100,000 to 500,000, while other sources give prevalence based on the form of the disease being considered. The prevalence of the autosomal recessive and dominant forms are present in 1 in 250,000 and 1 in 20,000 respectively. The age of presentation also depends on the form being considered, with the autosomal recessive form presenting during infancy, the intermediate form during childhood, most often in the first decade, and the autosomal dominant form between ages 20 and 30. For reasons unknown, Costa Rica has a higher incidence of osteopetrosis. The photograph on the right is a famous display in England showing a case of osteopetrosis. Notice how this typifies the so-called marble bone appearance. Generalized symptoms of osteopetrosis include bone pain, loss of vision and hearing, and oftentimes facial paralysis. Signs associated with the disease are fractures, delayed tooth eruption, dental anomalies, increased susceptibility to bacterial infections, and osteomyelitis. Severity of the signs and symptoms depends on the form of the disease under consideration. The picture on the right depicts how an increase in bone growth in the cranial vault could compress neurovascular canals, including those containing the cranial nerves. In the autosomal recessive form of osteopetrosis, increased bone density due to lack of osteoclast function can cause obliteration of bone marrow, compression and paralysis of cranial nerves, and difficulty fighting infections such as pneumonia. Prognosis for these patients is poor, and most do not survive the first decade of life. The intermediate form, or marble bone disease, has similar neurologic manifestations as the autosomal recessive form, but oftentimes to a less debilitating degree. Impaired vision and hearing can be experienced along with the effects on the dentition, such as a delay in eruption, oligodontia, dental anomalies, and enamel hypoplasia. Increased bone density may have more effects on the mandible than what is experienced in other forms of osteopetrosis. This form of the disease does not affect mortality, and therefore patients with marble bone disease will still need dental treatment throughout their lives. The autosomal dominant form is oftentimes not discovered, as nearly 1/2 of cases are asymptomatic and less aggressive, with discovery of the disease occurring at the time of a pathologic fracture. When the cases become severe, bone pain and neurologic disturbances may occur.
Erlenmeyer Flask deformity. It is a long-standing term used to describe a specific abnormality of the distal femora. The deformity consists of lack of remodeling of the metaphysis with abnormal cortical thinning and lack of the concave metaphyseal curve, resulting in an Erlenmeyer Flask-like appearance. It has been reported in an heterogeneous group of craniotubular bone dysplasias, including frontometaphyseal dysplasia, metaphyseal dysplasia pal type, diaphyseal dysplasia element type, Melnick needles osteodysplasia, dysosclerosis, and osteopetrosis.
This is a quick radiology, and today I'm going to talk about what are the causes for Erlenmeyer Flask deformity. Come on, this is 2 minutes of radiology, that's it. If you see a word Erlenmeyer Flask deformity in USMLE or any other medical board examination, what are the causes that it should strike your mind? Come on guys, this is for entrance preparation for your USMLE or for any other medical examination preparation. Remember, what is a past disease? Nothing but metaphyseal dysplasia. That's known as metaphyseal dysplasia. Okay. Thalassemia, very important, very important. Thalassemia, Erlenmeyer Flask deformity seen in thalassemia. Osteopetrosis. Then we have what you call Gaucher's disease. Okay guys, so what are the causes for Erlenmeyer Flask deformity? Pels disease, that is a metaphyseal dysplasia. Okay, metaphyseal dysplasia. Thalassemia, really very important, and the osteopetrosis and Gaucher's disease. Okay guys, these are the important causes. There might be plenty of causes for that, but for USMLE, try to remember these things. Okay guys, thank you so much for watching this video. Take care.
Application in medicine. It is caused by failure of osteoclassification or function and mutation in at least 10 genes have been identified as causative in humans. Osteoclasts are highly specialized cells which degrade bone minerals and organic bone matrix. These processes are crucial for bone remodeling and the maintenance of bone biomechanical stability and mineral homeostasis. The classic radiological features of osteopetrosis comprise diffuse sclerosis affecting the skull, spine, pelvis, and appendicular bones. Bone-modeling defect at the metaphysis of long bones such as funnel-like appearance, the Erlenmeyer Flask deformity.
Alright, let's talk about osteopetrosis. Osteo means bone, petrosis refers to rock-like. So this is a disorder in which you have abnormally thick, heavy bones. It's an inherited defect in bone resorption. Now, if you remember, bone formation is a balance between osteoblasts, which lay on bone, and osteoclasts, which resorb bone. Now, this balance is constantly occurring throughout life so that you're always laying down some bone and always resorbing some bone. Now, a defect in bone resorption in which you're constantly laying down bone and laying down bone but can't resorb it results in an abnormally thick and heavy bone. Now, despite it being abnormally thick and heavy, it fractures easily. think of it like a piece of chalk. A piece of chalk is thick, but you can easily crack it. Now this disorder is due to poor osteoclast function. It has multiple genetic variants. Most important is the carbonic anhydrase 2 mutation, which results in a lack of acidic environment that's required for bone resorption. An acidic environment is necessary in order to remove calcium to resorb bone. Now, in order to generate an acidic environment, the enzyme carbonic anhydrase is necessary. Carbonic anhydrase combines water and CO2 to make up H2CO3. Carbonic acid then breaks up into a proton and bicarbonate. Now this proton, which is the acid, leaves the cells, and this is what creates the acidic environment necessary for bone resorption. If osteoclasts don't have the ability to generate this acidic environment, they won't be able to resorb bone, and this is exactly what occurs in the carbonic anhydrase 2 mutation. The clinical features of osteopetrosis include bone fractures. Now remember, although the bone is thick, it's going to be very weak, hence it's more prone to fractures. And this is because there is no proper balance between the osteoclasts and osteoblasts. And in order to make strong bones, you need to have a balance between the osteoclasts and osteoblasts. Patients can also have anemia, thrombocytopenia, and leukopenia. So now this occurs because the thickening of the bone replaces the medullary space, which is called a myelophysic process. Myelophysic process which knocks out the ability for hematopoiesis. Hematopoiesis, which means generating blood cells. So if hematopoiesis is knocked out, individuals end up with anemia, low red blood cells, thrombocytopenia, low platelets, and leukopenia, low white blood cells. These individuals end up with extramedullary hematopoiesis, so this blood cells are going to be made outside of the bone marrow, either in the spleen or the liver. Patients can also develop vision and hearing impairment. This is due to the thickening of the bone that compresses the cranial nerves as they try to exit the skull, and hence they end up with these impairments of vision and hearing. Patients present with hydrocephalus. This is due to thickening of the bone at the foramen magnum. Patients can also develop renal tubular acidosis. This is when patients develop metabolic acidosis within the blood due to a defect in the tubules. This is seen with a carbonic anhydrase deficiency. Tubular cells have the ability to take water and CO2 to make H2CO3 in the presence of carbonic anhydrase, which catalyzes this reaction. Now, H2CO3 breaks into H plus and HCO3 minus. The hydrogen ion transfers into the lumen and joins with NH3 to form NH4. This is important because it can be excreted, getting rid of acid. When you get rid of acid, this results in a net gain of bicarbonate, which goes into the blood, maintaining pH of the blood. So it acts like a buffer. Now, if you don't have carbonic anhydrase, you won't be able to generate this acid, and therefore you won't be able to excrete this acid, and you won't be able to get the net gain of bicarbonate. So these individuals become acidotic. Now, what is the treatment of osteopetrosis? The treatment would be a bone marrow transplant. Now, you may ask, how would a bone marrow transplant help? Well, think of it this way. The problem in these individuals is that their osteoclasts are not functioning properly. Now, an osteoclast is a macrophage in bones, and macrophages are derived from monocytes. Monocytes are derived from the hematopoiesis process. Hence, a bone marrow transplant will give this individual the ability to make normal monocytes, hence generating normal osteoclasts and taking care of the problem. In summary, osteopetrosis is an inherited defect of bone resorption that results in abnormally thick, heavy bone that fractures easily. Now, this is due to poor osteoclast function. This may be due to multiple genetic variants, one of which is the carbonic anhydrase 2 mutation that leads to loss of the acidic environment that is required for bone resorption. Now, clinical features include bone fracture, anemia, thrombocytopenia, and leukopenia with extramedullary hematopoiesis due to the bony replacement of the marrow, which we said is called myelophysic process. And these individuals present with vision and hearing impairment, hydrocephalus, and renal tubular acidosis, and the treatment is bone marrow transplant.
Pros and cons. Pros: the prognosis may change in some patients after bone marrow transplant. Life expectancy in the adult on some forms is normal. Treatment is largely supportive and is aimed at providing multidisciplinary surveillance and symptomatic management of complications. Prenatal ultrasound diagnostics can be made towards the end of the second trimester, although the molecular diagnosis is recommended as it can be done using samples earliest from the chorionic villus.
Radiographic findings of this disease are tough to categorize via the lesion acronym due to its systemic nature. Location is generalized and should be apparent in most facial bones. Edges are well defined because the bones affected are well defined. The shape descriptor is not applicable as this is systemic in nature, and the internal structure is sclerotic and vastly radio-opaque, which is evident from radiograph on the right. From a dental perspective, the most affected structures are the inferior alveolar nerve canal and cortical bone trabeculation. Teeth may be displaced. Number and size are not applicable as it is systemic in nature. Here's a nice radiograph showing the diffuse radiopacity of osteopetrosis. The sagittal view perfectly depicts the sclerosis that can happen in the calvaria. These are some other radiographs showing the systemic effects of the disease, which in this case are apparent on the phalanges and tibia and fibula. Differential interpretations of osteopetrosis includes other osteosclerotic bone diseases. Paget's disease of the bone is included in the differentials because of bone and neurological pain involvement. Notice the appearance in the radiograph on the right of generalized cottonal appearance of bones. Along with this, patients will have elevated alkaline phosphatase levels, which will distinguish this disease from osteopetrosis. Acromegaly involves hyperplasia and ossification of bone, which may cause paresthesia and feebleness that could be mistaken for osteopetrosis. It can be removed from the differentials based on blood tests showing elevated growth hormone levels. Finally, hyperparathyroidism is associated with bone pain, headaches, and other neurological changes. Radiographic findings of Brown's tumors and radiolucencies, along with increased alkaline phosphatase levels, will differentiate hyperparathyroidism from osteopetrosis. The course of treatment largely depends on the severity of the case. Most times the patient has mild symptoms and treatment is supportive in nature. In more severe cases, however, a marrow transplant or an osteoclast-stimulating drug may be beneficial. From a dental perspective, it is important to recognize the inherent risk of osteomyelitis. Thus, excellent hygiene and preventative measures like premedication and root canal therapy instead of extractions may be necessary. If uncomfortable with treatment of such a patient, referral to a hospital setting may be appropriate. Furthermore, if a patient presents with radiographic findings that suggest osteopetrosis, referral to a physician for blood tests is also appropriate. This radiograph on the right depicts a case of osteomyelitis associated with osteopetrosis, which obviously can affect dental treatment.
And finally, here are some key points of osteopetrosis. Osteopetrosis is a disease of non-functioning osteoclasts that cause an increased density of bone. Symptoms include bone pain and cranial nerve compression. Signs include easily fractured bones and increased susceptibility to infections. The histological findings on the right depict a mouse model with normal bone trabeculation, D and F, and induced osteopetrosis in E and G. Notice the fibrotic marrow cavity on the right, which can lead to decreased hematopoiesis and thus an increased risk of infection.
Radiographically, osteopetrosis will appear with diffuse sclerosis and obvious radiopacity. The most commonly affected structures on a dental radiograph will be the inferior alveolar nerve canal and cortical bone trabeculation. The radiograph on the right depicts how bone trabeculation can be affected, most notably on the posterior right mandible. Finally, in most cases, the best course of treatment will be supportive in nature. Here are the resources for our project, and here are our image credits.
Cons. At present, no effective medical treatment for osteopetrosis exists. Fractures and arthritis are common and require treatment by an experienced orthopedic surgeon due to the brittleness of the bone. Dental problems such as dilated tooth eruptions, ankylosing abscesses, cysts, and fistulas are common. Chilled or malignant form is the most severe despite treatment. Usually it leads to death in the first decade of life due to severe anemia, bleeding, infections. Issue of blood in Ecuador. In Ecuador, due to lack of the instrument, exams, and methods to diagnose this disease, the prognosis of life is low. People have to go to northern developed countries to pay for the proper exams to diagnose osteopetrosis among other bone diseases. A total of 10,000 consists of the genetic exam and control exams, aside from the pharmacology treatment, which consists in 200 for 15 milligrams of calcitriol each day. The life expectancy improved with bone marrow transplant, valued in 250,000 or more.
The symptoms of osteopetrosis vary between the different levels or classifications. However, the most common symptoms are bone fractures, low blood cell levels, impaired vision or loss and hearing, and/or dental problems related to infections. Due to fewer blood cells that are being made, this can cause complications such as anemia, different bleeding problems, and many infections due to low white blood cells. Bone fractures, particularly in the spine or hip, are considered the most serious complications of osteopetrosis. Although you may not have fallen, spinal fractures still can occur. Your vertebrae can be weakened to the point at which it may crumble. This can result in back pain, short stature, and a hunched forward posture. As being shown in these x-rays, when being diagnosed with osteopetrosis, the bones in people appear usually to be more dense and chalky white. With very severe cases, bone marrow transplants may need to be performed. Physical and occupational therapy can help people cope and deal with their situations on a daily basis. A good balanced diet can help people with osteopetrosis live a long and healthy life. Good hygiene and dental care is also very important for people with osteopetrosis. This can help prevent many dental infections.